Why some people get easily addicted while others not? What is addiction? Is it a brain disease? What are the causes? Hello everyone, I'm Dr. Ahmed Taifour. Today we are going to discuss addiction. Addiction by definition is not having control over doing, taking, using things to the point that it could be harmful. Addiction, it's going by two categories: addiction to substance and behavior addiction. Addiction to substance like alcohol, drugs, solvent, even water. By addiction to behavior, it's like sex, food, porn, video game, internet. These two categories of addiction. Stage of addiction: first use, continued use, tolerance, when we have to increase the dose of the substance, and after tolerance, dependence. Dependence means physical sign or distress when withdraw or abstain of the substance of this behavior. The last stage is addiction. Addiction means that there is physical distress sign even using this substance, and it's characteristic by denial. Physical psycho case is denial for the addictor that he is in case of addiction. Two major aspects of addiction: biochemical and psychological. For the biochemical aspect, it's the hallmark of addiction of any behavior or substance. Being addicted is releasing large amount of dopamine. Dr. Anna Plemke, in her book Dopamine Nation, says dopamine is a neurotransmitter, a bridge between two neurons, one presynaptic neuron and postsynaptic neuron. This dopamine is characterized, is released two cases: in experience to reward and in experience to movement, which is very interesting. Movement relation to reward, because when we remember the early humans, when he was looking for water, looking for food, he was walking. So walking bound to releasing of dopamine. Even for the very primitive organism, we saw that releasing a big amount, a lot of dopamine when the environment see food. Dopamine is not the only neurotransmitter, but it is the most important neurotransmitter. We are in every day we are releasing dopamine. This make this what we call baseline rate dopamine. We are always releasing dopamine. When we are, or by anything, make the body or the brain release a large amount of dopamine above this basic rate, we come to a case of high or pleasure. When any case or situation less than baseline, we come to a kind of pain, which is depression. So dopamine, we are releasing dopamine. There is a baseline of dopamine. This baseline of dopamine, we always releasing dopamine. It's depend upon the situation, above this baseline and lower this baseline. The problem is when we are expose ourselves to chronically or repeatedly we expose ourselves to a situation or to a substance make us releasing a lot of dopamine for a long time or repeatedly. The brain in defense to make balance going through a moment of pain. This moment of pain is very important because it's alert, it is alarm us to stop, to abstain from this behavior or stop taking this substance. If we catch this moment, then we will stop. It's okay, no addiction. If we combat this situation or this moment by involving more and more in this substance or in this behavior, we will come to a case of addiction. That means that nothing will be enjoyable. Nothing will be enjoyable because now we have a lot of dopamine. We are in a circle. When come to pain, large involve more, we will get to a case of addiction. Our baseline level of dopamine is determined basically by genetics. We will see some people are stable mood, by some people is easily too excited, easily to get depressed. But it is environment play a role in, as we see, when we expose ourselves to a large amount of dopamine, then this baseline dopamine will be higher, so we will get to a case of nothing will be enjoyable. Then we need time, it's need time for the brain to come back to its basic line of dopamine, this baseline of level of dopamine. This is the biochemical aspect of addiction. The psychological aspect of the addiction is the cause of addiction for small percent is seeking for pleasure, but the most percentage of seeking addiction is escape from pain. Dr. Sam Vaknin said recently, he has theory of addiction that the person who get addicted, he feel of inferiority, he feels that he is down. So by defense mechanism, splitting, called splitting, he is by addiction remove his situation from all bad to all good. So the person who get addicted is in the case of he feel deep inside he is nothing. He gets the addiction to transfer his situation from all bad to all good. So addiction is now it is not a brain disease. He is a choice. He is not a brain disease. He is a choice. Man has to be grown up. People have to grown up. Find a passion, follow your passion. As I said before, it's dangerous because you are following your passion. Maybe sometimes it's misleading you. Maybe you will involve in the addiction. So, what is the solution? What we will make to get our dopamine to our basic necessary basic of amount of dopamine? We should looking for a new adaptive wave. We should learn ourselves how to get to enjoy small things in the life, small around us, small things, small jobs, small new adaptive way. Nature is very healing, good healing power because give us amount person around us, intimate relationship and open relationship give us amount of dopamine. So every day scan your life, scan your environment. What can I do for jobs, new jobs, get dopamine, a new relationship, a new adaptive ways. What can I? Small things in life get us, bring us a large amount of dopamine instead of involved in this vicious circle. Pain more involved, dopamine pain more. We cut this vicious circle by scanning our environment. Enjoy the life you are. Be. Enjoy your family, enjoy your environment, enjoy your nature, enjoy your job. Get dopamine from these small things. So it's when you make different things enjoyable from different resources, then you cut this vicious circle. Stop is very important in the moment, when the moment of pain, because brain always look for balance for pain pleasure. Balance is very important for brain. We catch the moment when it is a moment of pain, that is alarm for us. Brain give alert, stop, abstain this in behavior, stop taking this substance. So by awareness we master our case. By awareness, by learning, we can. So we will wait after stop. We will wait until the my dopamine level for the brain come back. We should stop, not for it is alert, because we have many things to do, and if we not stop, we have a dangerous consequences. Learn to experience pleasure by little things. Boring is scary. Why boring is scary? Because the person who is boring, he's imagine himself that he is doing things he had to do, but really he's doing nothing. He just hate these things. He manipulate his brain by going through addiction. So the last, how we can help this person who been get addicted. First of all, the person is denial, is under stage of denial. He denial he is addicted, he is hide his addiction. So first of all, we should aware, give him learning thoughts to be aware of what is going inside him. Isolation is not the solution. We should support, go to professional, and no blame, just support. Can addiction be cured? Yes, can be cured. It is difficult way. It is a long time. We had to patience with the person. We should have willings. It depends upon severity of the case, but it can be cured with patience, with willings. But it is can cured, and nowadays we have a big hope that everything will be by patience, by learn, by psychoanalysis, by new substance, it is can be cured. Thank you.